viewers. My name is Ben and this is the Moss Report. We're on location here in southeastern Tijuana, Mexico with Teresa, who works here at the International BioCare Hospital and Wellness Center. It's a lovely location, a very quiet, nice neighborhood, and we're going to have a little tour and walk through, and Teresa's going to tell us a little bit about the areas of the hospital that we're going to be looking at. Thank you, Teresa, for your time and for the tour.
Yes, welcome to BioCare Hospital.
Thank you.
The rain is not permitting the patients to take advantage of the patio here, but it's usually taken advantage of with nicer weather.
It's lovely. I see you growing some vegetables out here too, no? This is
No,
these are just decorative plants?
Yeah,
this one looks like a squash.
Flowers. No.
Okay.
No, we do have some herbs growing somewhere. There's fish in there somewhere. Upstairs to our left, we have the dining room. You can enter through here or through the reception area.
I see. That looks good. Absolutely.
Okay.
Thank you.
We love our dining room. We encourage even the inpatients to come and have their meals here, and weather permitting, again, the outside terrace.
It's very bright and welcoming.
Yes, we
smells good in here.
Yes, let me go ahead.
All right, thank you.
The freshly squeezed juices, we always have fresh fruit. We make our own yogurt. We make our own granola. We bake our own bread. We have baker on staff. There's always hot cereal, the organic coffee. And
Lovely.
we can, since you have a camera, we can go into the forbidden area.
Oh, okay.
This is the kitchen. It's a lot of hustle and bustle. Everything is made fresh.
It smells so good. I just love it. It doesn't smell like,
This is not hospital food.
No. I've been around plenty of institutional food. I was a cook in the Army.
Oh, no.
It doesn't smell like an Army kitchen. No.
Our reception area, which is also very busy. This is where we man the drivers. There's a lot of comings and goings with all of our fleet of drivers.
I see.
And also...
so people come in to the airport, you pick them right up at the airport and deliver them back to their hotels or wherever they're staying. Do you have inpatient services here too, so people stay over?
Yes, we're going to see that downstairs.
Very good. Okay. A lovely reception area. Lots of fresh air in here, I can tell you. Everything, I'm really impressed by the air quality. It doesn't feel clinical at all.
We have air purifiers throughout the facility. That's the business office. This is where payments are taken care of and insurance billing and all that. 8 doctors on staff, and we bring in specialists as needed. We just passed the ozone, but we can't really go in there. But we can go into the dark field microscopy, the live blood analysis.
All right.
That's right in here with the open door. Are you familiar with this, Ben?
No.
It's it's a fascinating test. They take a drop of blood from your fingertip, put it on a laminate, and the microscope will show actually the blood swimming around in there. How is it? And we do this at the beginning, at the patient's treatment, and again at the end, so they can see the improvement. Yeah, this is a fascinating test. Yes,
so,
live blood analysis.
And it does it does cell counts and
not cell count.
Okay.
No, we don't count with this kind of test. Is to see the numbers, we have to do the CBC.
I see.
Cell blood count.
Okay.
This is to check the blood alive. As you can see, it's moving. That's the red cells.
I see. Wow,
And
that's a powerful
these are the
microscope.
white cells. The
I see.
magnification on this kind of test is 15 to 16,000 times.
That's what I'm saying.
But right now it's a picture, there's no video. So usually when we are doing the test, we can see inside the cell how it's moving. The granules of the cell, they are moving.
Interesting.
And the cells, they are moving too.
And the health of the cell you can determine by the motion of it.
Yes,
With
that's
how
it.
much it's moving,
The-
how active it is.
Yeah, the motion inside the white cells.
Amazing.
Uh-huh.
Really amazing. Thank you so much.
You're very welcome. sir.
Appreciate it.
Gracias, Dr. Shirley.
Uh-huh.
Yes, you could spend hours in there, really.
I'm
It's
sure.
fascinating, yes,
Hello.
fascinating test. Now we're coming up on the outpatient treatment room, which, I keep on working up on the camera, sorry.
Oh, you're fine.
And here we also have the two hyperbaric oxygen chambers. There's actually somebody in there. You see the
You
toes.
see some
This
toes.
is pressurized oxygen. Elisa is one of our nurses
Nice to
here.
meet you.
And over here we have Elias. He's the head nurse here.
Hello,
Hi.
Elias.
This is
I'm Ben
Teresa.
Moss. Nice to meet you.
Hey,
Doing a
hi.
little video.
Yes, Ben Moss. Very good.
Yes.
That's right.
We have had Mosses before.
Yes. Yes, we do.
Go ahead.
This is one of our surgery rooms, which again, we can't go in.
Okay, understood.
And these are infrared saunas that patients are also welcome to use. And
And
what we're
it-
going to do is we're going to use the back stairwell.
Okay, very
to
good.
access the. Again, this is usually set very nicely. but
Right,
now because
I
of the
understand.
rain, so take it away. The exercise equipment is also good.
Good morning.
One room where we're taking care of this. Okay,
It's fine.
do you feel, hi Liz, welcome. We just did the upstairs, now we're gonna do the downstairs, but we're gonna enter through the back stairwell. This is,
Okay.
this can be very slippery, so please hold on.
All right, I will.
Please hold on. And then
I
we'll
will.
Come out at the front of the hospital again.
So this is where an ambulance might enter to come drop a patient
This is,
here?
this is hardly
Loading
ever
dock.
used.
Okay.
Hardly ever used, but yeah, we have to have it for emergency and for,
Understood.
yeah, so this is the back. We have, come on in.
Okay, thank you.
We have 16 rooms, double occupancy, and right now I'm pretty sure they're all full. I'm gonna see which one is
Okay,
is
we'll
available
just
to
follow you.
decide. This is just for outpatient surgeries.
What is the connection between the Amish and
They
the...
just love to come here.
I see.
Because,
Hello.
They're also into natural treatments.
Okay.
And,
Is there a religious component as well? I mean, do you have special arrangements to
They
have their...
themselves, every Sunday have their services.
I see.
Marcelino, which room is empty where I can show on a tour? Do we have an empty room?
Creo que el 7. I think.
But is it open?
Pretty sure.
Is it locked?
Interesting.
It's locked. We're gonna back up. This is the only room we have.
Okay.
So anyway, they themselves
Yeah.
gather
Uh-huh.
and have services on Sunday. Sometimes the ladies get together on Saturday afternoon for tea. They love to have tea.
Mm-hmm.
They get all their crocheting and all their manual.
So they found
Crafts.
you, and now they tell each other about you.
Yes. Mm-hmm.
Interesting.
Exactly.
I would think that given Dr. Rodriguez's attitudes and approach to the microbiome and the importance of nutrition, that the Amish might have a better, healthier microbiome because of the way that they eat and grow food.
But even then, you have to teach them because they usually don't eat anything raw. They cook everything and
I
they
see.
can everything and they preserve everything.
I see.
So we kind of have to teach them how to eat. So now they do have like a salad, vegetable garden.
All right.
That they can make their fresh salads.
Right.
So yeah, eating raw is very important. Turn on the light, the bathroom lights also. So you can see everything is handicap equipped. The closets have a safe deposit box. They all have a key. And you see the rooms all have a key. They all have a TV. They all have their own hot air, cold air, whatever. And the bathrooms are all handicap equipped. So
Fantastic.
hallway. And again, the 8 doctors that we have on staff. But sometimes we need to bring in a urologist, a cardiologist, a neurologist, a gynecologist. Yes, fine. Yeah, we bring in specialists as needed. Okay, when we get up to the front, you'll see the nurses station open. Okay, this is Dr. Noelia Arteaga, one of our neurophysicians.
Hello.
Good morning.
Nice to see you. Good morning.
And Rosa, this is our nurses station. This is our other operating room. This is where we do the whole body hyperthermias.
Okay. Can we get a peek in there? Or?
No, it's all sterile.
Okay, understood.
Looking at it. Oh no, it's not. It's not a machine. It's a procedure.
Oh, okay. So
Yeah.
it's localized, not a whole body?
Oh, it is whole body.
Oh,
No, it
so
is
then
whole
it's
body.
not like a table with a big thing over it and all that business? No.
No,
Okay.
it's internal. We elevate the internal core temperature.
Oh,
in
I
the body.
see.
Yeah.
Through
But
a blood
a doctor has
direct
to.
heating.
The doctor has to explain that to you. I don't
Okay,
know. But they're in
understood.
there for at least 4 hours.
I've
It's done
seen
very slowly.
some of these whole body hyperthermias are like a tent, like your hyperbaric machine. Only
No,
it's
that's
got-
oxygen. The hyperbaric is oxygen.
Right, but there's some of the hyperthermia have
Yeah.
machines
It
like
elevates
that.
the core body temperature.
Yeah, understood.
Yeah, like they're in there for 4 hours. It's a very slow elevation and very slow, and they're
Interesting.
monitored the whole time.
Yeah.
They're there, and many times when the patient is a candidate, when the temperature is at its highest, that is when they introduce small doses of low-dose chemotherapy, and it's highly effective because that's when the cancer cells have either already been killed off by the heat or are very weak
They're
or
weakened.
damaged. So the chemo works very well under those circumstances.
Very good.
So, but again, I'm just giving you general information.
No, I understand.
Doctors have to
I
be more precise on that.
got it.
And Dr. Rodriguez is practicing and treating patients actively now?
He actually does not see patients. He has his team of.
Right.
Yeah, he rarely sees patients, honestly. He
Okay.
rarely sees patients. Okay?
All right, but he's
But
in
he,
charge.
he oversees
Right.
everything, and he knows everything that's going on with every patient.
Right.
Right.
But he is
Understood.
not the attending physician. He has
Got it.
somebody else assigned to it. But yeah, he is very much aware of
Understood.
everything that goes on, from maintenance to kitchen to the laundry room
Sounds
to
like he's all
everything.
up in your business,
he
actually.
He is just.
Does he let you all alone to just do your job, or is
Well,
he getting involved?
He gets involved at every level and every aspect. So he's
I
always on
believe
our
it.
tail.
He seems very keenly aware and
Yeah.
very well-spoken and thoughtful
Yeah.
person.
He
Very
really
glad.
demands excellence from everybody.
That's
so.
great. I want to thank you for taking a few moments of your time and just hear a little bit about your story, your daughter's story, how you ended up here, and what your experience has been like.
Okay. My daughter had metastatic breast cancer. It came back last year. And so she lives in Boston. So Boston, of course, has great medical care. They do. And so, but she wanted something different. We knew about BioCare because the owner of a radio station in Prescott, son, came here when he was
Okay.
17.
Oh, I see.
And he's now 42.
Okay.
They, in the United States, they just said, no, there's nothing we can do for you. So they came down here, and he's cancer-free.
23 plus years later.
Yes. I think we're 10 days in. So,
Okay.
so they're doing tests, she's getting supplements. She had that hyperthermal treatment on Monday. And so there, nothing happens overnight with cancer.
With the low dose chemotherapy at the same time.
Which I love that idea.
Yeah.
You know, just bring the temperature up and then.
Right.
So,
Do you feel like you're kept pretty well informed as a family member about the different ways in which your daughter's being treated here?
You know, maybe it's because I'm an American and maybe because my background's in law. I want all the information all the time.
I see.
I mean, everything. And Denise he knows what he's doing, Mom. And if you ask, and I've gone into his office, like, so, you know, what's this? I think as Americans, our need for information is very different. They're competent. They just like, we're taking care of it. And you can ask questions.
Yeah.
It's just me personally.
Right.
Just walk up to me and give me this and give me this and give me that. You know?
Right.
But I think it's more, I'm going to say a Mexican way. They're just quietly confident. They know what they're doing. You can ask questions. I think some doctors are more maybe forthcoming. Well, I hear it from other patients, just like, oh, I just trust them. They're all good. I mean, and there's patients who are trusting themselves to surgery here that are having really good results.
Well, listen,
Yeah.
we wish you all the best.
Thank you.
And your daughter for her recovery.
Hope is what you get here.
Yeah. The following segment is an edited version of the full clinic conversation available at themossreport.com. Dr. Rodriguez, thanks so much for having us.
Thank you very much. I welcome you and I thank you for visiting us. First, let me tell you, I'm 79 years old, just like your father. And I graduated in medicine more than 50 years ago. And I have been working on integrative medicine, complementary medicine, alternative medicine, whatever you want to call it, for over 40 years. And in all those years, of course, Ralph Moss has been an icon. He's had the Moss Report. And as I was telling you, he's been in many ways a beacon for many people because he has made it clear what are the options for many people when you have cancer.
You have not dropped the thing, you continue working, you continue to do your thing. And great for you, and great for everybody that listens to your
Thank
work.
you. And the same here, Dr. Rodriguez. I mean, we go way back, right? I mean, to the days of Bradford and the days of Mike Colbert and so forth.
I do not buy the idea that we see more cancer because we're living longer, which is what the medical establishment, unfortunately, tells people. What has been, I would say, my conviction after so many years is that, one, you do not have to have cancer if you play your cards right. Second, if you have a cancer, you have to go back on your tracks and change that brought you to that condition. That is connected inequivocally with lifestyle.
Well, I want to know more about how you treat cancer. So I understand that, you know, people are coming to your hospital and they're put on a regimen, a dietary regimen, and there's some fasting and there's some use of the microbiome. But what if the person needs more immediate medical care? So I'm interested in what, within the larger context of your preventative philosophy, what role does medicine have?
We have a staff of consulting physicians, all of them MDs. We have a full staff of registered nurses, and we run a hospital, period.
Yeah.
That's why we say BioCare Hospital, first and foremost. So we have access to just about everything medicine can do, to X-ray, to scans, to surgery, to chemotherapy, to whatever. We have access to that because we're a full hospital. Mm-hmm. But I always say we're a real hospital with an alternative heart. In other words, when I get a patient, I go through the normal routine. You have a cancer, it has metastasis to this, and now it's producing pain in the bone, it's et cetera, et cetera, et cetera. So I'm going to treat that cancer, to the best of my knowledge, in using things as much as I can that are not going to harm the integrity and the performance of your body. Inflammation is the broth where cancer cells develop well. Because inflammation mediators, the cytokines, block things that can help you avoid a cancer. But if you don't do that, if your intestinal flora is not doing what it should do, then we begin to have problems. You're at BioCare Hospital, you're going to be getting probably 1 intravenous every day. You're going to be getting an enema every day. You're going to get an implant every day. You're going to be changing your diet every day. When the intestinal flora metabolizes fiber, one of the good products is butyric acid. Now, butyric acid has been proven to have an anti-cancer effect.
Yeah.
So there you have it. Your body is trying to cure you. You're just not giving it the chance.
Well, Elizabeth and I were invited to sample some of the breakfast fare here in the dining room of the International BioCare Hospital and Wellness Center. They place a huge amount of importance on a healthy gut and microbiome, and some of the natural ingredients that they grow here or source locally, organically, and juice fresh on location that I'm drinking right now is part of how they treat patients. It's amazing to think about this approach of nutrition as treatment for cancer. Well, cheers, and to a healthy gut and health in general.